This is not a street crime. It is not a robbery caught on camera. It is a silent crime, hidden behind medical paperwork and official stamps. For years, the US government was being robbed, not by hackers, not by foreign agents, but by fake clinics. This is the story of a $400 million Medicare scam. The scheme operated inside the healthcare system. Criminal networks created fake medical clinics. On paper, they looked legitimate. Real addresses, official licenses, medical staff listed on records. But in reality, many of these clinics barely existed. Some never treated a single patient. Others treated patients who didn't even know their identities were being used. The scam targeted Medicare and Obamacare programs, government-funded healthcare systems designed to help the elderly and vulnerable. Instead, they became a cash machine for fraudsters. The process was simple. The criminals obtained stolen patient information, names, Medicare numbers, medical histories. They also recruited or paid doctors to sign off on fake diagnoses. In some cases, doctors never even met the patients. In others, signatures were forged. Once the paperwork was complete, the clinics billed the government. Claims for treatments that never happened. Medical equipment that was never delivered. Therapies that were never provided. The government paid, again and again and again. Over time, the fraud grew. Millions turned into tens of millions. Eventually, the total reached over $400 million. The scam went undetected for years. Why? Because the system trusted the paperwork. If the forms looked legitimate, the payments went through. The criminals exploited this trust. They opened clinics, billed aggressively, and shut them down. Then they opened new ones under different names, different addresses, different shell companies. Money flowed through bank accounts, then offshore, then disappeared. The real victims were never just the government. They were taxpayers. They were patients whose identities were stolen. And they were people who needed real medical care but faced delays and shortages because of fraud. Eventually, investigators noticed patterns, unusual billing volumes, clinics charging for impossible numbers of procedures, doctors linked to dozens of unrelated clinics. A national investigation followed. Federal agents moved in, clinics were raided, accounts were frozen, arrests were made. Dozens of people were charged. Clinic owners, medical professionals, middlemen, money launderers. Some faced prison sentences. Others faced massive fines. Many were banned from participating in federal healthcare programs for life. But even after the arrests, the damage was done. Hundreds of millions were already gone. And recovering that money was nearly impossible. This case exposed a dangerous truth. Healthcare fraud is one of the most profitable crimes in the world. It doesn't require weapons. It doesn't require violence. Just paperwork and patience. Scammers know the system is complex. They know oversight is slow, and they exploit that gap. The $400 million Medicare scam is not an isolated case. It is part of a larger pattern, one that continues to threaten healthcare systems around the world. This is why awareness matters. Fraud doesn't always look criminal. Sometimes it looks official, clean, professional, and that is what makes it so dangerous. If you want more real scam stories, major fraud investigations, and true crime documentaries, subscribe to the channel and comment below. Did you know healthcare fraud was this massive?